we're still getting people joining. So please, again, make sure you're muted if you are on a phone, or if you're on the internet and you've joined GoToMeeting that way, just go ahead and mute as you join in.
Well, that works.
Okay. We are about 11:05, so I'm going to go ahead and get started because we have a limited time frame here. Again, we're going to mute everybody, and if you're not already manually muted, that would be great if you could do that for us as we go through it. There's going to be a lot of background noise and that kind of thing, so just to try and limit that a little bit, that would be fantastic. So I just want to give a really quick shout out to our PR marketing staff who worked really hard on us and our team. They did a great job, and I know that they've been working a lot of hours, as we all have. So just thanks to them for helping put together the Together We Rise campaign for the county and our partners. I'm going to go ahead and get right into it and introduce some of our speakers today and our participants today. So go ahead and hit the next slide, Danielle. So we had quite a big group register today, which is fantastic. And it looks like we've got a little bit of everyone joining today from state and local elected officials, and as well as county and city staff with us, and some of our local health experts who are going to be also presenting. So I'll detail that out shortly. Next slide. And I know some of you are aware, but those of you who are not, daily since the start, essentially, of this whole process, the Emergency Operations Center with the county was enacted at the beginning of March. And as part of that Emergency Operations Center, we've put together a COVID-19 business response team. And here you can see all of the partners. We've met on a daily basis to both gather items to be released to the public for either business or health or citizen support. But it's taken a lot of team effort and collaboration. So all of these folks are on the call here for support today. So that's our team that's put this together. And I just want to thank all of them for all of their really hard work and all the time and effort that we've put towards this. Next slide. And actually, I will say, since I didn't think about this, I'm on the internet and some of you are on a call, so we don't have to go back to the last slide, but I just want to kind of detail really quickly who those folks are. So we have the Maryland Department of Commerce, Western Maryland Representative Andrew Sargent, of course, Washington County Department of Business Development, me, Susan Small, City of Hagerstown Director of Community and Economic Development, Jill Thompson, Executive Director of the Washington County Chamber of Commerce, Paul Fry, the Executive Director of the Convention and Visitors Bureau, Dan Spedden, Executive Director of the Greater Hagerstown Committee, Jim Kirchable, Executive Director, Officer of Goodwill Industries, Dave Schuster, who's been representing our nonprofit, Director of Public Safety and Campus Police, Eric Byers from HCC. And we also have the support of our EOC from Sam Anderson, and also Tom Brown. So today's panelists, we have 3 who've joined us today. We have Deputy Director of the Health Department, Dr. Diana Guevara, and Chief Executive Officer of Meredith, Dr. Malik Joshi, and our Chief Quality Officer of Meredith, Carrie Adams. So again, just kind of want to go over a couple little things just for, because we have such large numbers here. We had about 250 register today for the webinar, so it's important that we kind of all understand we're going to remain on mute during the presentation so we can kind of minimize the background noise. And then really just kind of a higher level understanding that the purpose of the webinar is to try and provide our businesses with the latest health information and guidance and resources. We know you're going to have a tremendous amount of questions, and we're going to try and get to as many as we can. But the presentation is going to be recorded, and it's going to be uploaded onto our washcorises.net website, so you can go back and look at that. Next slide. And I think I mentioned this before, but I'll just make sure we know that the questions are going to be taken at the end of the webinar, so that's why everyone's been muted at this point. We're going to give you kind of an overview of things and have our panelists go through some slides with you. But ultimately, all your questions will be put into the chat, and then we're going to put together an FAQ document on that same website, which you can see right there is washcorises.net. And then we're talking about potentially doing another one of these webinars, so just stay tuned for that information. But just to be aware that the press may be joining the call as well. Next slide. And this is just kind of a high level disclosure for you. We understand that, you know, there's a lot going on, and the information that you're going to be presented with or that's coming at you all the time and daily very quickly. Just know that we're here to try and offer a little bit of guidance and maybe some clarification on some things, but we are not the professional organization or the professional and legal advice that you probably should be getting from your own professional advisors. So it's important that you know that, you know, we're here to help, but please know that you should probably consult with your professional advisors for any real detail to legal advice and that kind of thing. Next slide. So I'll just kind of dig in from the beginning and how we kind of got here today. If you've been watching the governor's press conferences, like most of us are, he's a really fantastic speaker when it comes to outlining and bullet pointing the timeline, which is kind of what we've done here for you. We've provided also on the right-hand side of the slide the stage 1, the county's version of the governor's orders for stage 1 of the COVID-19 recovery plan. And you know, as you all know, March the governor declared a state of emergency, and over the last several weeks, that's been the stay-at-home, shutting down all non-essential businesses and limiting large gatherings. But it's just really important to note that the county is going to be following the governor's orders as we move through that. So it's really important that we all continue to maintain the social distancing efforts and the measures to limit the spread. And then ultimately, that is preventing our hospitals from exceeding their capacity. But as you take a second to read through the timeline, I just want to reiterate to you, and I know we've talked to many of you over the phone and through emails and back and forth, and I know you've expressed concerns and questions, and we completely understand that we know you're frustrated. You know, so we want to take this opportunity to recognize that and know that your business has probably been struggling through that in this challenging time that we're trying to navigate with you. So because there's so many unknowns and so many questions, we're going to do the best we can to try and support and guide you through that. Because believe me when I say, we all want to see things open again, but we just have to do it safely and make sure that we are doing it when the governor says we can. Next slide, Daniel. But to everyone's credit, I think it's really important to note that with your courage and hard work and sacrifices, we have certainly flattened the curve. And I know our medical and health professionals are going to speak to this in a little bit. And the most recent order as of today, Friday the 15th at 5 p.m., all the counties in the state of Maryland were authorized to begin that stage 1 of the state's roadmap to recovery. But that was at the discretion of their local elected officials. So we understand that maybe not all counties and jurisdictions were quite ready for that. But we know that Washington County is moving forward with that stage 1, and that's why we've provided it here. It certainly doesn't mean that we've beaten it, and we definitely have a long road there. But just keeping that in mind, that we've taken the proper measures and the proper precautions to get to this point. So, and next slide. And as I said, the local jurisdictions are the ones who are empowered to decide this, but it's a really good point to clarify that just because we've been given the green light to move into stage 1, that doesn't necessarily give us the opportunity to be more lenient than the governor's orders. So in other words, we aren't going to open faster or move forward with anything. That we can be more restrictive, but we can't move forward faster. So, but based on our health data in Washington County and our current capacity, the county is positioned to open to the fullest extent of stage 1. So, and we'll get there in a little bit. We'll get into that in a little bit, but next slide. So in rebuilding the economy while protecting our public health, the important thing to keep in mind is a delicate balance as we go through this, and all of these bullet points sort of talk about, you know, the important things that we need to be monitoring and preparing. So, and we've gotten a toolkit put together on our county website on WashingtonHorizons.com that will also help you to maybe prepare your business to reopen and start to understand what things you can do now to start preparing for that. Because ultimately, we need to be able to build confidence in our consumers to get them back into our shops and back into our businesses. And for our employees to come back. So in order to operate safely, we just have to take ownership of it, and everyone has to do their part to continue what we've been doing. Next slide. So at this point, I would like to welcome our first presenter and our first panelist, Dr. Diana Guevara from she's the Deputy Health Officer and Medical Director with Washington County Health Department. I'm going to ask Danielle Dr. Guevara, are you there? Are you unmuted? Give us a second here. Working through these virtual meetings are always so interesting. We really appreciate everyone's patience as we go step by step here.
Hey, Susan,
Can you hear me okay?
There we go.
Yes.
So thank you very much for having us participate in this. I just have a couple of slides which are sort of reinforce the messages that you brought forth in your introduction. And of course, Earl Stoner, Health Officer, and I will be available for questions after these presentations. So the next slide, please. So where are we now? Our first case in Washington County was reported on March 21st. As of yesterday's report, we had 306 confirmed cases with 12 deaths, and 139 people had been released from isolation, meaning either that their symptoms had resolved and enough time has elapsed that they are no longer considered infectious, or in some cases, it means that they have been retested and tested negative. The case rate in Maryland, as a state, is 598 per 100,000. In Washington County, we have a lower case rate of 203, 204 rounding up per 100,000. Death rate, similarly, you can see that in the state as a whole, there's a death rate of 31 per 100,000. And our own death rate is lower at approximately 8 per 100,000. Next slide, please. So, you know, I think at this point, as we start to transition from mitigation phase to reopening, the social distancing needs to be, and the mitigation efforts that have been made should be recognized because they have really been very effective. As was mentioned earlier, one of the goals of social distancing, of flattening that curve, is to push out
we want to provide you the best service. And our e-statements are one way of doing that. Access your account securely and quickly 24 hours per day. Ask any associate to help you sign up for e-statements today.
Can we mute that other line?
We know your is valuable, and we'll do our best to be right with you.
So it's apparently okay. Thank you. Thanks for muting. So the goal of mitigation, the goals of mitigation are a few. One is to reduce the peak and delay that so that the healthcare system is not overwhelmed. Ultimately, you hope to reduce the total number of cases, although that is sometimes a harder goal to achieve. It also buys time for treatments, for vaccinations to be developed. It simply gives you some breathing room when there's an epidemic going on. And there's a lot of hard work that's gone into mitigation in the state of Maryland, and I think that should be recognized as we go into our next phase. So these slides, next slide, please. These slides are a little hard to see. They're actually screenshots that you can view the website if you want to look at these more closely. It's the Institute for Health Metrics and Evaluation, but it gives you a timeline. Up on the top, you can see the social distancing mitigation efforts that were put into place. That graph beneath is a measure of mobility, how much, once the mitigation efforts were put in place, how much people were moving around. That is often cell phone data, actually, that informs that. Next slide. So we can see that people did respond to the efforts. People really did follow stay-at-home measures, and I think there's a lot of credit that goes to all of the citizens of Maryland for following these measures. Daily infections, I think that we can see that, you know, with unfortunately in taking these screenshots, you can't see the timeline up above, but it's pretty striking that as soon as stay-at-home order was placed and other mitigation efforts were put in place, that trajectory started to flatten out. The curve started to bend, it started to flatten, as they say, and I think that's telling us that these have been very effective measures. If we move on to the next slide, we can see there that that has also impacted the strain and the utilization of hospital resources. Going forward, of course, there's a big uncertainty area. That light purple area is an uncertainty area. And that's where we can make a difference going forward. I think that the way that we institute, and we've talked about this way that we implement reopening, will have a huge impact on whether we're in the, whether we're high on that uncertainty area or whether we are able to keep cases and utilization of hospital resources in the lower range. Next slide, please. So I think, you know, as a public health official, I would say that our message is that reopening is critical, but we need to do this in a way that's mindful of the mitigation principles, that the success of the reopening will depend heavily on how well we continue to pay attention to what we can do to reduce transmission of infection. So the governor's guidelines suggest continuing to telework whenever that's possible. Masks and facial coverings there's more and more evidence accruing that that is really critical to reducing transmission of infections. Places that have had universal masking have seen pretty dramatic decreases in infection transmission. Continue to follow social distancing guidelines. And then I would just add in the hand hygiene and surface disinfection that are becoming second nature, hopefully, to everyone, because those are also really critical to reducing new infections. So from the public health perspective, those are things to just try to remember are going to be, they've been critically important up to this point and will continue to be. Thank you.
Thank you so much. I really appreciate all of that information. And again, folks, this slide deck will be available on our website, which we'll make sure that everybody has, but you can also just write down real quick, washcorises.net, and that's the URL where you're going to want to go to get this information if you're on the phone and can't see the slides. So next, I want to introduce Dr. Malik Joshi, CEO for Meritus Health. He's been joining us here this morning.
Great, thank you very much. Hi, good morning, everyone. It's Malik Joshi, joined with Dr. Carrie Adams, the Chief Quality Officer for Meritus Health. And thank you, Susan and Dr. Guevara, for setting the stage. We wanted to share some of the data that we're tracking as well for the safety of our organization and our workforce and our county and our community. And before I even start, I just want to say thank you very much to all the businesses in the county for the amazing generosity and donations you have provided to our organization, from masks to PPE to food. You've really kept our healthcare heroes going. So I just want to personally thank all. Hope we've been able to get to all of you. If we haven't, we apologize, but the generosity and the spirit of the community is really phenomenal. So just thank you very much. If we can go to the next slide, please. We have 10 measures that we're looking at in terms of COVID-19 to make sure that we are flattening the curve. And as Dr. Guevara said, I think we have flattened the curve. The amazing work as a community that we've done in this bundle of interventions has caused this to happen, which is terrific, and we want to continue to see it happen. So here are the 10 measures we're looking at, and the good news is we've got 8 in green, which is good, and 2 in yellow. In the green, we have been testing a lot, and we're out of the gate early on that. We've done now over 6,000 tests in our community, and we continue to do about 400 a day. So in the green, we have the capability to test. Important. In the yellow, where you've seen all the stories, PPE is always at a critical level just because there's so many unknowns as to what we can get, what we've ordered. But we are above 14 days in all our critical supplies. In terms of bed capacity, we are below what we thought would happen in a surge, so that's in the green. We're at about 60% occupancy, so we have beds available. In terms of ventilators, you've heard a lot about the need for that. Our trigger would be at 80%, we need to do something differently, and right now we're only at 11% of ventilators being used throughout the whole hospital, even less just for COVID-19 patients. Having new admissions is something we track. We've been having 1 to 2 admissions a day in our hospital for weeks now, and we want to make sure we don't go above that for any consecutive period of time for like a week. Surge planning, we are ready to surge up to 150 COVID-19 patients if we need to. We're ready to add 120 more beds in our hospital if we need to. Fortunately, at this stage, we do not have to, so we have surge planning capability. It's been about 15 days of doubling of cases, and we want to continue to make sure that doesn't drop. If it drops significantly, that's something we would have to look at. The next one is in yellow, and that's outbreaks. You've read a lot about that, whether that's in nursing homes or in other areas where people get together. We want to prevent that as much as possible because that can ignite a lot of clusters and outbreaks. Contact tracing, again, under the leadership of the Washington County Department of Health, they have the capacity to do that. And then deaths. We have unfortunately had 5 deaths just in Meredith Medical Center outside the community. We want to make sure that doesn't grow. So again, really positive in the 8 greens, 2 yellows that we want to track, and this is important for us. If you go to the next slide, please, you can see just again our census. You can see we've been hovering at a stable, not obviously the best level, but a level of about 8 to 12 COVID-19 patients in the hospital every day. And of course, many under investigation. If you go to the next slide, please, just to give you a little bit more. The first line tells you what we thought the peak would be back in early April. You can see it go up pretty high. Every week, it keeps flattening and flattening based on new data. Again, Dr. Guevara said it really well. Social distancing, masking, washing hands, self-isolation, appropriate sheltering. It's the bundle of all that coming together that's made this happen, which has really allowed us to get to this phase 1, which is terrific. And the next slide, please, shows you again, without getting into too much detail, that we have ventilators, we have ICU beds, we have medical surgery beds, we have capacity that if this keeps going up, we're able to take care of everyone in our community. Of course, at this level that we've been at in terms of the infection rate and not spiking up. And the last slide I would add before I turn it over is that important metric for us is just new COVID-19 hospitalizations every day. We're hovering around 1 to 2 a day. If we can keep that going, that's very good and manageable. Obviously, we want to get that to 0, but that's, again, in range compared to the numbers we saw early on. So I would just turn it back to you. I want to end by saying, again, thank you to the community for everything we've done together to get us to this stage. Thank you for putting in the bundle of interventions that Dr. Guevara talked about, the public health interventions, social distancing, masking, washing hands, appropriate sheltering, isolation. Let's keep it up. Let's keep tracking these metrics, and I guess we can continue to move forward, which would be a great thing for our community. We'll be available for answering questions afterwards. Thank you, Susan.
Thanks so much. I just want to take this brief second to really thank everyone, all the staff at both Meredith and the health department with your lead, Dr. Joshi, and also with Earl Stoner's lead. And I know you guys have been working tremendous hours at this with our EOC and probably your staff. So just thank you to all of you and everyone on the front lines for keeping this going and reporting back to us. I know it's a lot of work, so just want to say thank you again. So moving forward, again, I mentioned earlier that we put together a website, a URL specific to the Together We Rise campaign, and it's become kind of the one-stop shop. All of us submit data to it pretty often, daily. So we have a really well-organized preparedness list for reopening that you can, kind of a checklist, you can go down through that. That's available there, as well as COVID-19 Business Toolkit, which is, it's got some really great resources in it from the reopening guidelines from the state, as well as a getting prepared update to the policies and practices, how to plan a safe reopening, and it even has a sample reopening plan in it. So we encourage you to go to that website, download that, and kind of use it as a guideline. But we've also broken out safety best practices by industry, and we're adding to that as more information comes in. So the FAQs, just want to talk about that for a second. We are gathering your questions today. If we can't get to it today, or we don't have the answer today, I encourage you to continue to communicate those questions and concerns with us. You can do that. There's going to be an email address on one of the last slides here, but you can certainly send them to us if we can't get to it today. But the FAQ will be a great place for you to continue to look back. That's going to be a live document that's going to get updated, no doubt, daily, because this information is coming at us pretty quickly. So just trying to gather it all for you and try and guide you through some of it. So, and then again, just for FYI's sake, in the chat, Brittany Higgins has posted the webinar recording, so you can also find that on there as well. So, and just important to note, the city and the county staff has been working together with our administrators and elected officials to work through the local grant program. So more information on that to come, just stay tuned for that. So next slide. Here's just a sort of a sample of the Together We Rise, the preparedness to reopen checklist that I just talked about. And there's some high-level bullet points to things you can do now rather than wait, kind of be ready to be ready. So we were talking this morning in our group, and Paul Fry brought up a really good point. To start off with, you should inspect for touch points. I didn't really even think about that. And it's super important because as you walk through your businesses and your space, I'm sure that there are touch points that we don't even think about. So just kind of analyzing your space, first of all, before you start creating that sanitation and operational plan. But there are some really great best practice kind of resources out there. So this is one of them, kind of a checklist for you to revise and change your business plans accordingly. So just think as Dr. Joshi pointed out, as a slow recovery, we just have to take the right steps and stay on track to continue to move forward. Next slide. And lastly, if you heard Governor Hogan's press conference, he pointed out that there is a back to business pledge, and we have this also available on our washcorises.net website. If you can download this, sign it, take a minute to really kind of take some pride in this, because we feel like taking this pledge is really going to help build that confidence with our consumers and with our customers and even our employees. We definitely play a critical role in protecting our citizens through this. So as you read down through this, really take it seriously as we take it step by step here, and proudly display the pledge in your place of business as you open, and even before that to say, hey, we're on board here. So please feel free. You can download that at both our website, and the link is on there on the slide deck here to take the pledge. So with that, we'll move into, again, just want to reiterate, the chat function is going to be how we're going to answer questions today. And again, we may try and do another one of these if we can get everybody available to do it again. We'd love to do this if you weren't if you know someone who maybe wanted to see this, but you can download it on our website, again, at washcarises.net. And the last bullet point there has the email address for you to send any questions. And we're going to try and get to them as quickly as we can, but just stay patient with us. We're all working through this. I know it's a massive amount of information. We all want our questions answered. So, and Dave Schuster, you posted, and I appreciate that that Goodwill Industries will be posting the pledge on social media in addition to the physical locations. So that's another good idea for you. So,
Susan?
Yes.
This is Paul. There is a question, and it is in reference to a toolkit we set out on page 23. Best practice for restaurants and bars. First bullet says during stage 1 dining parties at least 6 feet apart, prohibiting more than 8 people. Third to last bullet point says prepare outside seating. That's a typo. We need to fix that, and that's not correct at this point. We got that information from another county that thought restaurants would be opened up a little more. So right now, restaurants, indoor and outdoor seating is still prohibited. And so that was bad information. We'll fix it on the next version of the toolkit.
Yes. Thank you.
There's another question. What is the county government doing to limit liability issues for employers who follow the CDC guidelines, but employees still get sick?
Sure if that's an Andrew question. I don't see
what we're hearing, and Jim Kurtzville, if you can, I don't know if you can unmute yourself with a *6.
Oh, did he called in? Okay.
Yeah.
The challenges of virtual meetings.
We know it's a concern. We've addressed it with our state delegation and with our federal delegation, our U.S. senators and our congressmen. They are trying to get legislation passed. Generally speaking, do what's supposed to be done as far as following social distancing guidelines, using the masks and the cleaning guidelines. It's still a question to be addressed. We know it's a concern, and again, we've sent that information. I know Senator Serafini, I think, is on the phone. Senator, I don't know if you can *6 and unmute yourself or not.
Paul?
Yes, is that Andy?
Hello? Yes, it is.
All right, it worked. Go ahead. There was a question about liability.
Yeah, so this has been identified from the very beginning. We've had conversations with the Maryland Attorney General's office. As Paul said, we are waiting the federal government to deal with this. There is a thought, Senator Castley is an attorney, and one of the problems is going to be for somebody that says either I'm an employee or I'm a customer, how will we ever know for sure that they got it at your place of business? So he does feel that that would be fraught with some challenges in the courtroom. We also believe, and there is a piece out by Miles and Stockbridge, a webinar like this, an hour long. We can make those slides available to people that walks you through. On the EEOC and on OSHA, they have guidelines. But frankly, the idea is if you follow, and Paul kind of said, the safe practices, you will have a defensible position. If you do everything that you do, reasonable people should be able to do this. But we can get that information posted. There's a PowerPoint presentation. There are clear guidelines. But that protection is something that's paramount both at the federal and state level, and we're working on that. So I think there's protocols. If you follow, you have what we call a safe harbor. If you've done those and followed those, and beyond that, I think there's a lot of conversations about how we'll provide some protections, once again, through the legislative process.
Thank you, Andy. And then Jill Thompson, I don't know if you're on the phone, if you can *6. I know there was some other questions maybe you fielded, if you could address those.
Sure. Good morning, everyone. Some questions that we did receive in advance. For example, are restaurants allowed to use outdoor seating or to set up in an outdoor format. So at this time, restaurants are only allowed to offer delivery, takeout, and curbside pickup. And there were no changes in the guidelines for restaurants with the governor's announcement this week. And I'll ask Andrew Sargent if you want to add anything further to that.
No, nothing really to add to that. Andrew Sargent here. I see there are some other questions. So is there an estimated time frame that we may move into phase 2? And that has not been established yet. We could be here for a little while, but I think it's likely or possible that the governor could find other industries that to reduce some regulations a little bit about like he did as we move into this phase 1. So I know that there are a lot of industries and people forwarding concerns and about their specific industries that are going to be taken into consideration as we go here. So no, certainly no estimated time frame for a definitive phase 2, but I think everything is in motion. Everything is being considered during phase 1.
I'm happy to take the next question, which is, do you have suggestions for hair salons, the challenges related to practicing social distancing while working with clients and needing a little more direction? There are some directions that hair salons can open at 50% capacity. So 50% of the number of customers that you've had previously at full capacity. And that you, your stylist would wear masks, your customers would wear masks, and they're able to remove their mask only if the service that you're providing it requires that. So the cutting of hair and the blow drying of hair, there was some questions as if a salon also offers other types of esthetician services or nail services. Those are still prohibited. And then we also received a call to our office that nail salons or massage businesses are still restricted from opening.
Excuse me, this is Paul again. Just real quick, if everyone who is not muted, please mute your phone because we're getting a little bit of background noise. So if you're on the phone, it's *6 to mute and unmute. And if you're on the video, just mute yourself, please. We have been hearing from a number of webinars and suggestions. Really, again, if you're not muted, please mute yourself. We've heard from a number of folks that it's important that businesses work to build confidence with their staff, and with their customers, and with the public. And you can do that by following the guidelines, posting what you're doing on the outside of your business, and really adhering to the safe practices of social distancing. And have the conversation with your employees if they have concerns about coming back to work. We'll share with you at some point a number of ways that you can assess and survey your business. But again, it's really important that we're instilling confidence that you're doing things safely. And as was mentioned earlier, it's very easy for us to surge again, and then we could go backwards. We want to make sure we're still moving forward. And we will supply information on how you can survey and assess your business and how you can do that.
I'll bring forward one additional question. The governor's order allows businesses to open at 50% occupancy. So questions have come forward as to how does a business get their occupancy numbers. So for businesses located in the city of Hagerstown, our fire marshal asked that businesses reach out by phone or by email and have their address, business name, type of occupancy, and the square footage of their customer area available. And then a calculation can be quickly made, and also to be able to provide a business with a sign for posting at their entrance. And in Washington County, we're doing some clarification for businesses outside the city of Hagerstown, the process similarly through the appropriate agency. at this time, do a rough estimate. So move forward and use good judgment and a rough estimate, calculating yourself approximately what 50% of a normal occupancy would be, while specific guidance is directed.
Andrew Sargent here. I see a question up here about whether it pertains to whether or not the how much direction can be made at the local level. And just to clarify that, so the governor released his executive order and the associated interpretive guidance of that executive order, and that set basically a maximum amount that a county can open, and then counties are given the opportunity to throttle it back from there. There are some, and it was suggested that the more metropolitan counties closer into the DC Baltimore areas, that they do in fact throttle it back from what the governor has allowed, and they've done that. So it's a local decision to go any more restricted than what the governor is suggesting, but certainly can't be any more open than what the governor is suggesting. So I hope that clarifies why we are where we are right now.
Looks like the next question is from a legal standpoint, are we required to enforce that our staff wear face masks in an office where everyone is appropriately social distancing? So I guess a point of clarification on the enforcement of PPE in a professional office.
Yeah, with the guidance, and again, if you go to CDC, the guidance we're hearing and seeing for best practices is if you're in a closed office and the door can be closed or it can be sectioned off, you don't have to wear a mask. But the recommendation is if you're in a meeting and if you're 6 feet apart, you need to be wearing a mask for best practices. So again, if you're segregated, you're alone in your office, the door's closed, or there's a barrier there, you're fine. But when you're interacting with people within your office, even with social distancing, even in a large meeting room, 10 feet apart, the recommendation is wear your mask. There's another question here. Any thought to closing a small portion of Potomac Street to allow for outdoor dining? Traffic could easily be rerouted and people would flock to downtown. We spoke about this. Jill, do you want to address that, or Dan?
Sure, I'm happy to address it. At this time, the governor's order doesn't permit outdoor dining, but we're monitoring that, and we think that this is an idea certainly worth exploring. And there's been some conversations within the city already on possible pre-planning for that, and exploration of the logistics of that in anticipation of the loosening of the restrictions that might permit it. And Dan, feel free to add.
Yeah, this is Dan Spedden, President of Convention and Visitors Bureau. I was on the Tourism Recovery Task Force, and we discussed this at length, especially for large urban areas. Picture old architecture like Fells Point in Little Italy in Baltimore. And a group of Annapolis business people, retailers and restaurant and bar owners signed a petition asking the city of Annapolis to do the same. I think it's a great idea, but it's not appropriate for this phase. But it is appropriate to start planning for that if we decide it's something we want to do.
And I do want to go back to the question posed about having your employees, if you're legally supposed to have them wear it. This is something also, if you have a labor attorney you can speak with, HR professional, because there's some issues there. But we'll send out some best practices. We'll send out a link. Again, important is communication with employees and the safety aspect. And we'll send out some best practices links here, either not on this webinar, but subsequent to this.
I have an additional question that I received before the web seminar. Is can I operate my fitness or recreation business by providing outdoor services? So gyms or outdoor recreation outfitter companies could offer outdoor classes and excursions as long as it's 10 or less people. And that would be consistent with the governor's order to operate outdoors, but also the gathering of 10 or less people.
And Susan and Andrew, there's a question about face coverings. Is a suggestion or a requirement still? There appears to be some confusions over the governor's order. Andrew, do you want to take a stab at that?
Yeah, I think they are required still, especially if you're in a public space. I mean, we covered when it's reasonable to take your mask off if you're in an enclosed office and alone. But anytime you're interacting with somebody, especially the public or customers, you need to be covered, and your customer needs to be covered. And remember, you always have the right to refuse service to somebody who is not compliant. So, and that's a way that we can encourage the use of all the time of masks and face coverings. So yeah, still required for sure in public interaction situations.
And to help reinforce that, again, best practices, there's some signage in the toolkit, posting rules at the front of your office or a retail establishment or business. Here's the regulations or requirements to enter. And one of them is wear a face mask. And so I think that's important to reinforce. And frankly, you and your employees, when you're out and interacting, need to wear it correctly. I've been to a number of retail establishments and the employees are wearing a face mask under their nose. And so again, we have to do some training and make sure we're reinforcing and modeling the correct use of this face mask.
All right, any other questions at this time? Again, we'll be taking questions by the website below there, the email below, pr@washco-md.net. And we will put together an FAQ that'll be a live document, continually updated on that website, washcorises.net. So keep looking for that. Anybody want to add anything else from the group?
Okay.
What?
Okay.
Yeah. I got a pain in the back. Go on again.
If not, I guess we'll go ahead and go on about our day. Still want to thank everyone for all their hard work, especially those on the front lines of all of this, and continue to stay in touch with us. We will keep you informed as best we can. And thanks for your patience working through our virtual meeting today. But have a great day, and hope to see you all again soon. Thanks.